Well, good afternoon, everyone, and thank you so much for joining the Superior Health Quality Alliance Roundtable conversation. For those of you who I have not yet met, my name is Kelsey Ostergren, and I am joined by a few of my colleagues today, Kim Heft, Jerry Hineker, and our guest speaker for today, Dr. Jane Peterson. So for those of you who have been joining these meetings over the last few weeks, welcome back. It's great to see you. For those who are new to the call, welcome. We're glad to have you. So this session that we host each week, as you know, again, is just sort of an educational session where we just highlight some important topics related to COVID vaccines and boosters, just on a variety of different things. So, hope that you're able to set aside 30 minutes each week to join us. And the one thing I would ask, and this is sort of a different ask than we've had in the past, but if there are any pebbles in your shoes or things that you're troubled by or working through, I would ask that if they sort of pop up for you as we're talking over the next half an hour, send me a message in chat. You can send it just to me directly, but this will be really helpful for us as we plan content to share and discuss in future sessions. We want to make sure that this is relevant and meaningful for you. So if there are those things that are kind of sore spots or trouble areas for you, we want to know so we can help you with them. As always, we will have a quick survey at the end of this session. Again, we just want to make sure that we're hitting the nail on the head and giving you education in the areas that you need it. So if you could just take a couple minutes at the end to do that, that would be awesome. As always, the PowerPoint slides are available. I have just put a link in chat to where you can download those. And before I turn it over to Dr. Peterson, the other thing is, as we're talking through the content for today, if there are questions or comments or things that you're wondering about or things that pop into your head as she's speaking, feel free to use the chat box for that as well. At the end of the session, with any time that remains, we will go back and use that for conversation. So with that, again, welcome. And Dr. Peterson, I will turn the floor over to you.
Thanks, Kelsey, and thanks for joining in today. I'm just going to give a couple disclaimers at the front here. If any of you are immunologists, and forgive my cartoons, because I made this presentation basically because these were based on questions that I was getting, really good questions. So why do I have to get a booster? What's different between a booster and getting infected with COVID? How does it make our immune system work differently? And it's a really, really good question. The problem is, you can get into a lot of complicated answers that nobody really wants to hear. And it's very hard then to, answer that same question for someone else. So I tried to take on the challenge of saying, okay, how do we make this kind of fun, easy to talk through, something that maybe all of us could take some pearls away when we get these similar questions, without making it a dry talk on immunology. So you can go to the first slide that just is the objective. So this is what I'd like everybody to be able to take away today. Be able to say, what are the 3 ways our bodies defend against infection? What are 2 ways the immune response to vaccine is different from infection? And then what are the role of boosters in extending the immune protection? So you can go to the next slide. So let's just start out with, so what are the 3 ways we avoid viral infection? Well, number 1, our skin. That's our biggest organ. It's kind of our big protection, keeps things out, keeps us from getting, we're bumping into viruses, bacteria all day long. Then there's the innate immune system, which is these natural killer cells. Those are the ones that hang out in our spleen, our bone marrow, our tonsils, our lymph nodes, and they're just cruising around all the time, kind of looking for things that don't belong. Viruses, bacteria, actually tumor cells. You've probably heard that we all develop cancers, on and off throughout our life. And these are the guys that are out there catching those before they cause a problem for us. And then there's the adaptive immune system. And that's what we're going to focus on today, because that's what helps. It adapts to help the body identify and fight either new or repeat infections. So I'm going to switch to the next slide. So what's happened when the adaptive immune response kicks in? Well, the race is on. That means the first two lines of defense have failed. And now it's a race between the infection, in this case that we're talking about today, the COVID virus, and your adaptive immune system. So the virus is busy replicating, causing damage to cells in your body, and the adaptive immune system needs to kind of quickly mount its defense to limit that damage. It is a complicated race, much more complicated than my two little Hot Wheels vehicles here, but it's really about the immune system figuring out which way to point its little gun on top and what to point it at. Who wins? Really depends on a lot of factors. You know, COVID has shown us that there are cases where the virus is most likely to win. If you're immunocompromised, you have chronic conditions, age, obesity, but the virus is also tricky. We also have found that healthy people end up with severe infection, and healthy people die from COVID. So it's really a function of how the virus and your immune system interact. So go ahead, the next slide, please. So this is my cartoon of the adaptive immune system. So the little balls on top are the COVID virus. I think we've all seen the little blue ball with the red thing sticking out so much, we probably have dreams about it. But that gets swallowed up in our immune system by cells who then put little feelers out, which are the antigens, which then the T helper cells read. It's kind of like they're putting a wanted poster out to say, hey, this is what you go look for. T helper cell, tell all your friends, this is what we're looking for. This is the guy we're after. So T helper cell sends a message to the B cell that says, hey, B cell, get busy making antibodies. So B cell over there with the little knitting needles is knitting up the antibodies. Then also says, hey, cytotoxic T cell, get out there and go get them. The cytotoxic T cell is the one that goes out and they're gonna kill those cells that are infected with that virus. They're gonna go out there and fight the battle. So that's kind of the main players in this whole play of the immune system. This is where I say if you're an immunologist, you're probably doing the big head slap because there are a lot of other factors, but it's really the main thing that's happening out there. So you can go to the next slide. So let's look a little bit more carefully at that wanted poster. So this is one of the interesting things and I think it's key to thinking about why the vaccine versus natural immunity can be different. So our adaptive immune system, looks at this thing and says, okay, let's get a good look at this. Let's look at all the spike proteins. Let's look at all this stuff so I can send the best picture out possible to those T helper cells. Well, sometimes we get a real nice clear picture. Sometimes it's a little bit more blurry picture. And so sometimes if you get COVID, you're going to mount a very good immune response. It's going to be very clear. There's going to be a clear picture sent out to the rest of the players. Sometimes you don't get quite as good a response. What causes that isn't exactly clear. You could be one of the lucky ones. You could be one of the unlucky ones. If you don't get as good a response or don't get as a robust of a response after a COVID infection, you end up at higher risk for a reinfection. The body may only make antibodies to a subset of the spike proteins, so you might not recognize the COVID bacteria when it comes around again. So next slide, please. So why is the vaccine really different? Now, I had to search around a little bit while to find the picture of a negative. Many of you probably, this is even going back in your brain here because we've had our cell phones and digital photography for so long. It's hard to even remember going to develop film and getting a roll of negatives. But what I think about and how I think about this is what the vaccine is actually giving to the cell is this negative. It says, okay, this is what you're looking for. So you don't have to get infected. The vaccine is saying, okay, here's the negative. Go out and make a whole bunch of copies, develop this and make a bunch of copies. And this is what you send out to your T helper cells. And now we got a nice, clear, consistent picture. Going to get the same picture. Everybody's going to get the same picture. It's going to have all the spike proteins. It's going to be nice and clear. And we know consistently what that picture that's passed along looks like. So you can, next slide, please. And that's really true for the mRNA vaccines. I think that's probably the closest to how they work, but it's also true for some of the other vaccines that are based on, viral vector technology, which is our kind of the technology that has been used in a lot of vaccines in the past. So here's kind of the adapted picture of the vaccine. So instead of the virus coming in and the having to get infected, this little cell just gets that picture of the negative, and now it can send out the wanted poster, and the same thing happens. Cytotoxic T cell doesn't have to go out and go after anything. It just has to be ready to go in case you do get infected. So next slide, please. But the challenge is what happens over time. Back, I don't know if we can even remember back early on in 2020 when COVID first came around, and people were getting infected, and the people who were made it through the infection. We thought, oh yay, whew, made it through, all's going to be good. I think we were all hopeful that COVID would be stable and that our immune response would be long lasting. Kind of like what chickenpox is. You get chickenpox as a child, or you get the vaccine, you don't tend to get chickenpox again. It's a very stable virus over time. Your immune response continues to be effective. That isn't what we got with COVID. We quickly learned that COVID likes to change and morph and shift very quickly over time, which then is a constant race between the virus and our immune system. But it is true that both infection and vaccines create immunity, but both wane over time. And that's what our problem is. The B cell, the little one that was knitting down there, there's something called B memory cells, and those sort of decrease in number. They're there. But just like anything, all of us, our memories get a little fuzzy over time, and so does our immune system. And so then we have to boost that immunity either with a reinfection, which is the riskier way to go because you're submitting your body to an infection and all the damage that can occur before the virus, before your immune system gets kicked in, or with a vaccine, which prevents you from the damage that the virus causes before the immune system kicks in. Next slide, please. So that gets us to the, what is the advantage of boosters over an infection? Well, as we talked about earlier, the real advantage of the vaccine booster is that more predictable immune response. You get a clear picture. An infection, you're never guaranteed of getting that same level of immune response, where with a vaccine, you're more likely to get a very consistent and predictable immune response to the virus that you're being vaccinated for. So next slide, please. The other one, and I think this is probably the biggest one, is you don't run the risk of a breakthrough infection. Breakthrough infections certainly can be mild. We're seeing that more common now with Omicron, which is great. But that isn't necessarily true. And even the mild infections are having, infections are having significant consequences for people. And then, of course, there are people that are still ending up in the hospital. So getting the virus it just has risks associated with it. If your immune system's a little bit sluggish and doesn't kick in quite as quick, that little virus can do a lot of damage before those cytotoxic T cells and antibodies get to work. And I think another thing to remember, and we've been dealing with this all through COVID, we don't really have a cure for COVID. Really, all our treatments are aimed at addressing symptoms or helping give a little bit of breather to let the immune system kick in. And this is, I think this is true with much of what we deal with in healthcare. A lot of our, even what we call treatments, are things that, help the body and put the body in the best chance of healing. But still, your body has to be able to do part of the work. And that's true. And that's what is we're really talking about with COVID and the immune system, is giving our treatments just give the body a little breathing room to let the immune system kick in. And then finally, what we've seen is, COVID's been sneaky. It likes to put on a lot of different disguises. It's really a master of disguise. We've gone from Alpha to Delta to Omicron. It changes hats and scarves and glasses. And our immune system needs to be able to recognize the virus variants. And so far, it looks like our vaccines are holding the course, that even as COVID has changed and morphed, and recently with it's whatever Omicron disguise it's wearing, it's continued to be effective. But the other thing with vaccines, and you've probably talked about this as well, is we have the opportunity to be able to proactively adapt vaccines based on what disguise we see the COVID virus putting on next. So far, we have not used those, but I think that's going to be the thing that as we look out into the future, probably is one of the things that's a big benefit to the vaccines, especially the mRNA vaccines, because they can be adapted quite quickly or much quicker based on variants. So that's really what I wanted to put together in hopes that my little cartoon version of the immune system and how the response differs between vaccine and infection would be helpful. So I'm kind of curious to see if anyone has any other questions. Happy to go back over anything again. So I will leave it at that.
Wonderful. Thank you so much, Dr. Peterson. I have not seen any questions or comments come through in the chat box, but I know we do still have about 10 plus minutes. So I will stop talking and just open the floor to the folks on the line. It looks like we have a really good sized group today. So for those of you on the line, feel free to unmute yourself and ask any questions you have, either of Dr. Peterson or your peers on this topic. Okay, so I do see a comment from Wendy in the chat. Will there ever be a vaccine that can be done yearly, or will we always have to have boosters every few months, like for influenza?
And that is a super good question. I think the jury is still out on that one, partially because we're still learning kind of how long our boost lasts. So I think it's, again, not from the geriatrician, not the immunologist viewpoint. My hope is that this will move more towards a yearly vaccine, or a yearly boosting, or whatever we want to call it. But I think it's going to depend on how rapidly the virus continues to change and what we continue to learn about our immune response and how long it lasts. So Unfortunately, probably still kind of a non-answer, but a really, really good question.
And there is another
Oh, the
comment
fourth dose.
from Angie, yeah, about the 4th dose.
Yeah. Is it the criteria the same as it was for the 3rd dose early on? You know, I don't know that I can, because I don't have the comparison criteria in front of me. My guess is it is going to be similar, or that it is similar, because it's the same issues at play. It's the folks that are, you know, that would have, that you would expect to have a maybe less robust immune response, or that their immune response would wane quicker, or that they would be at higher risk should they get a breakthrough infection. So folks with underlying conditions, folks that are immunocompromised, you know, folks that are living in settings where potentially COVID transmission is more likely. We haven't been doing, I work in long-term care, and so far haven't been doing, I haven't had, I don't know that I've even had anyone have a 4th dose yet. But we're probably kind of on the cusp of that based on where the facilities I work at are in when they got their booster shots. So we're on the cusp of talking about it, I would say.
Yeah, and I see a comment from Angie just clarifying that it was just released on February 11th. And Angie, you're right. I don't know what state you're based in, but I know there was just a HON alert that came out here in Michigan. I want to say yesterday, with some more details and information on that. So I know it's top of mind. You know, the state health departments are certainly thinking about it. But I would just kind of ask that question of other long-term care folks on the line. Is this something that you're starting to think about? Have you started, you know, these discussions in your facility? And if so, what does this look like for you? Has anybody kind of started trailblazing down that path yet? So Tracy's comment, they're just looking into anyone that may be eligible. Yeah. And so again, I know this is a sort of new direction. So I'm sure this is kind of in the works and on the long to-do list that you all have. So more to come on that for sure. Another comment, we have a few on chemo meds and thinking about giving another booster. Interesting. Okay.
Mm-hmm.
I just also wanted to add that in the chat is the link to the recent February 11th updates for the immunocompromised and booster doses.
Mm-hmm.
Thank you, Kim. See a comment from Angie. Their pharmacy consultant helped them to identify those that are eligible. Angie, I don't know if you can unmute and share a little bit about what that process has looked like and kind of what you learned. Maybe that would be something that's helpful for other folks as they start down that path as well.
Yeah, can you hear me?
Mm-hmm.
We sure can.
Yeah, we just found that when the 3rd dose was approved that we reached out to our pharmacy consultant, and when she did her monthly reviews, let us know, because I think it's based on, you know, diagnosis, and it's based on medications that they take that would put them in that category. That's why I was asking if it was the same. It really helped us out because there were definitely some residents I wouldn't have thought of. And then others that I thought that would be eligible that actually weren't. So it was really helpful, and just thought I would put that tip out there.
Yeah, I think that's a good way of going about it. And then even catching people, because, you know, some people have had their third dose at different times, not necessarily all, when either the facility had their, like a larger vaccination clinic or something like that.
It is a lot to keep up on. It seems like maybe it would be easy, but then you admit people and their dates are different, whether or not they've been offered the booster or, that kind of thing. So it is a lot, and having our consultant pharmacist who is in there at least every month, just be that extra set of eyes. It's been helpful in case we miss something. Also, I noticed in that, I'm just getting through that February 11th memo, but the other thing that changed that affected a couple of our residents, we had residents that came in post-COVID and they wanted to start the series, but couldn't because they'd had the monoclonal antibodies or something. And now apparently that's no longer a barrier. It doesn't really matter if they've had those. They can begin that as soon as they've recovered. They can start the series or get a booster or whatever.
Yeah, I think that's super confusing with the monoclonal antibodies and then Omicron. And my clinical work is mostly in the assisted living, and it's even more challenging because we don't even always have necessarily all the information on everybody, especially people who maybe don't. And the dates are just all over the place. So it'll be really interesting trying to figure out who's keeping up on all these booster dates over time.
One thing I'll say is being in Wisconsin, it helps, and I don't know what other states have access to, but we do have access to the Wisconsin Immunization Registry, because you're right, the information we get from the hospitals, the clinics, or the residents themselves, they can't give us dates, they can't give us types of vaccine, all of that kind of thing, which is all needed for NHSN data entry, and so that's been helpful too.
Yeah.
What other comments or questions are out there for either for Dr. Peterson or for your peers or even for our team?
I guess I'm just always curious to hear, what are the good questions that you're getting? What are the things that people are still really struggling with? I was, even with this talk, I kind of based this on, I had so many people that aren't in healthcare ask me some questions and tried to figure out, how do I put this in an email or talk about this in a way that people who have no familiarity with the immune system and aren't part of healthcare can kind of start to get their arms around, a complicated topic. I don't know if people are getting similar questions or having to kind of field similar discussions.
Jane, I was just going to ask you, because you do hear people say that they feel natural immunity is better than the vaccine, or then, there's been so much stuff even on the news where, if you're vaccinated and then you still get COVID, then you're like super immune. And so you hear people like, I should just go out and get COVID, even if they've been vaccinated. I mean, I loved your presentation, but I'm just kind of like, how do you answer that?
Yeah. And you hear that, and that's actually kind of the main questions that drove me to say, how do I talk about this? Because I think we get all these mixed messages. People say, natural foods are better than processed foods. Natural is better than this. Well, okay, why wouldn't natural immunity be better than, a man-made immunity? And it really, there's a, what's his, Watchman? He's in California. He does some, I'm blanking on his blanking on his name now. I'll think of it in the middle of the night. It does a lot of really, really good stuff on an immunization. And that's what he talked about. The challenge with natural immunity is you just don't know if you're going to be one of the folks that gets a robust immune response that's predictable, that will be able to identify COVID, or maybe you're going to get a not you get a little bit, but you're left vulnerable. And the advantage of the vaccine is we can control the message that's sent. So while you might be lucky with a natural immunity and get a immune response similar to what we're seeing with the vaccine, but there's also a pretty reasonable chance that you might not be. And that's really the risk that you run. Plus, like I said, also every time we get an infection, there is that virus does have a chance to start causing some damage within our body before our immune system kicks in. And the worse that infection is, or the more it can take hold, the more damage it can cause. And we know, that, COVID has, it shows us it can cross the blood-brain barrier. We see, brain impact from things through loss of smell. People are talking about hearing issues, balance issues, things like that. Obviously, the pulmonary issues that we saw, especially, with the Alpha and Delta, there's damage that it can cause. And so if you can avoid infection and the risks that come with infection, you're better off.
And Jane, thank you so much for that great explanation. And I really appreciate everyone's questions and commentary today. I know we are out of time. So thank you all again for joining us. Dr. Peterson, thank you for your fantastic update as well. Just a quick update for our session next week. We will be joined by an immunization nurse educator who will be talking about co-administration of COVID-19 vaccines. So we will be back next week, same time, same place. If you need anything between now and then, please feel free to reach out to us. And again, thank you for joining our sessions. Wishing you a great week, and we will see you next Wednesday.